Good morning, I am CJ Malari, and for today's video, we're gonna talk about Parkinson's disease. What is Parkinson's disease? Parkinson's disease is a degenerative disorder of the central nervous system. It belongs to a group of conditions called movement disorders. This disease occurs when nerve cells or neurons in an area of the brain known as the substantia nigra die or become impaired. Normally, these neurons produce an important brain chemical known as dopamine. What is dopamine? Dopamine is a chemical messenger responsible for transmitting signals between the substantia nigra and the next relay station of the brain, the corpus striatum, to produce smooth and purposeful movement. Loss of dopamine results in abnormal nerve firing patterns within the brain that cause impaired movement. This is the history of Parkinson's disease. Parkinson's is a condition that has been known about since ancient times. It is referred to in the ancient Indian medical system of Ayurveda under the name of Kampavata. In Western medical literature, it was described by the physician Galen as shaking palsy in AD 175. However, it was not until 1817 that a detailed medical essay was published on the subject by London Dr. James Parkinson. The publication was entitled An Essay on the Shaking Palsy. This established Parkinson's disease as a recognized medical condition. The essay was based on 6 cases he had observed in his own practice and on walks around his neighborhood. The essay was intended to encourage others to study the disease. Some 60 years after it was first published, a French neurologist by the name of Jean-Martin Charcot did exactly that. Charcot was the first to truly recognize the importance of Parkinson's work and named the disease after him. Who is affected by this disease? Risk factors for Parkinson's disease include age. Young adults rarely experience Parkinson's disease. It ordinarily begins in middle or late life, and the risk increases with age. People usually develop the disease around age 60 or older. Heredity. Having a close relative with Parkinson's disease increases the chance that you'll develop the disease. However, your risks are still small unless you have many relatives in your family with Parkinson's disease. Sex. Men are more likely to develop Parkinson's disease than women. Exposure to toxins. Ongoing exposure to herbicides and pesticides may slightly increase your risk of Parkinson's disease. Symptoms. Parkinson's disease signs and symptoms can be different for everyone. Early signs may be mild and go unnoticed. Symptoms often begin on one side of the body and usually remain worse on that side, even after symptoms begin to affect the limbs on both sides. Parkinson's signs and symptoms may include tremor. Tremor is a involuntary shaking or movement, ranging from slight to severe, and commonly affecting hands, legs, face, head, or vocal cords. Rigid muscle. Rigid muscle is a muscle stiffness may occur in any part of your body. The stiff muscle can be painful and limit your range of motion. Impaired posture and balance. Your posture may become stoop or you may fall or have balance problem as a result of Parkinson's disease. Loss of automatic movements. You may have a decreased ability to perform unconscious movements, including blinking, smiling, or swinging your arms when you walk. Speech changes. You may speak softly, quickly, slur, or hesitate before talking. Your speech may be more of a monotone rather than have usual speech patterns. Writing changes. It may become hard to write and your writing may appear small. And this is the pathophysiology of Parkinson's. Antipsychotic drugs, encephalitis, and other causes affects the substantia nigra. Next, the extraction of dopamine producing neurons within the basal ganglia and reduces the amount of available striatal dopamine. There is increase in acetylcholine. Excitatory activity of ACH is inadequately balanced. And the last one is difficulty in controlling and initiating voluntary movements. The primary motor cortex is a part of the brain that is responsible for initiating voluntary movements. Cure or treatment of Parkinson's disease. Parkinson's disease can be cured, but medication can help control the symptoms, often dramatically. In some more advanced cases, surgery may be advised. Medications. Carbidopa-levodopa. Levodopa is the most effective Parkinson's disease medication. It's a natural chemical that passes into your brain and converted to dopamine. We have two types of carbidopa-levodopa medications. These are inhaled carbidopa-levodopa and carbidopa-levodopa infusion. Inhaled carbidopa-levodopa. Inbria is a brand-name drug delivering carbidopa-levodopa in an inhaled form. It may be helpful in managing symptoms that arise when oral medication suddenly stop working during the day. Carbidopa-levodopa infusion. Duopa is a brand-name medication combining carbidopa and levodopa. However, it's administered through a feeding tube that delivers the medication in a gel form directly to the small intestine. And we also have surgical procedure. Deep brain stimulation. In deep brain stimulation, surgeons implants electrodes into a specific part of the brain. The electrodes are connected to a generator implanted in your chest near your collarbone that sends electrical pulses to your brain and may reduce your Parkinson's disease symptoms. MRI guided focus ultrasound is a minimally invasive treatment that has helped some people with Parkinson's disease manage tremors. Ultrasound is guided by an MRI to the area in the brain where the tremors start. The ultrasound waves are at very high temperature and burn areas that are contributing to the tremors. What causes the disease? In Parkinson's disease, certain nerve cells in the brain gradually break down or die. Many of the symptoms are due to a loss of neurons that produce chemical messenger in your brain called dopamine, including genes. Researchers have identified specific genetic changes that can cause Parkinson's disease, but these are uncommon except in rare cases with many family members affected by Parkinson's disease. Environmental triggers. Exposure to certain toxins or environmental factors may increase the risk of later Parkinson's disease, but the risk is small. The presence of Lewy bodies. Clumps of specific substance with brain cells are microscopic markers of Parkinson's disease. These are called Lewy bodies, and researchers believe that Lewy bodies hold an important clue to the cause of Parkinson's disease. Alpha-synuclein found within Lewy bodies. It's found in all Lewy bodies in a clump form that cells can break down. This is currently an important focus among Parkinson's disease researchers. How is a person's daily life affected the disease? As the disease progresses, people may have difficulty in walking, difficulty in talking, memory difficulties, depression, fatigue, and sleep problem. Number of people affected by this disease. In America, nearly 2 million people in the US are living with Parkinson's disease. This number is expected to rise to 2.2 million by 2030. Parkinson's is the second most neurodegenerative disease after Alzheimer's disease. Approximately 60,000 Americans are diagnosed with Parkinson's disease each year. More than 10 million people worldwide are living with Parkinson's disease. The incidence of Parkinson's disease increases with age, but an estimated 4% of people with PD are diagnosed before age 50. Treatment Centers Medical Research. University of Maryland Medical Center. It is located in 22S Green Street, Baltimore, MD 21201. The program director is Lisa M. Shulman. The University of Maryland Parkinson's Disease and Movement Disorders Center, a division of the Department of Neurology, is a full-service diagnostic center for Parkinson's disease. The center offers comprehensive and expert diagnostic, medical, surgical, and rehabilitative services for patients with a diverse range of other movement disorders. They also offer comprehensive and expert diagnostic, medical, surgical, and rehabilitative services for patients with a range of cognitive problems and dementias. To make an appointment with one of their physicians, please call 410-328-4323. And these are my reference. Harrison's Principle of Internal Medicine, Hope Through Research National Institute of Neurological Disorders and Stroke, Ferris Clinical Advisor 2022, Diagnosis and Differential Diagnosis of Parkinson's Disease, The Discovery of Dopamine Deficiency in the Parkinson's Brain, Journal of Neural Transmission Supplementum 2006.